Okay, so I'm gonna speak about the brachial plexus, but before that, I think I'm gonna give some introduction to the nervous system. Alright, so the nervous system is split up into two parts, yeah? The central nervous system and the peripheral nervous system, yeah? The central nervous system is split up into two parts, the brain and the spinal cord, yeah? So here we have the brain, as usual, very artistic, and the equally artistic spinal cord, alright? Now, the spinal cord is shielded by the backbone, right? Or the vertebrae. Now, these vertebrae are literally a lot of bones that encircle this spinal cord, and they have something coming out on the back and of the sides, but doesn't matter for now. It's just a bunch of bones over on top of each other, and yeah, their function is to protect the spinal cord. Yeah. Okay, so these individual bones are named based on their location. Alright, so the first 7 vertebrae are called the cervical vertebrae, right? So C1 to C7, cervical. And cervix just means neck in Latin, so these are the ones that you can find in the neck. Now in the thorax, you're gonna find the thoracic vertebrae, so T1 to T12. So you're gonna have 12 bones, which are labeled from T1 to T12, like all the way down. So you're gonna have T1, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, and T12 are the thoracic vertebrae, right? So you're gonna have the first thoracic vertebra, second thoracic vertebra, etc. Yeah? And then you have the lumbar vertebrae, right? So it starts from L1. L1 to L5 are the lumbar vertebrae. And lumbar, if you think like lumbar support, back support, it's the back, it's the lower back. So lumbar just means lower back, yeah? After that we have the sacrum and the coccyx, yeah? So sacrum we've seen before, and coccyx is the part of the sacrum that is just hanging out underneath. It's the tailbone, if you will. Alright. Now the point of this in the nervous system is because when you look at the nerves or the innervation to muscles, you're always gonna see like, I don't know, median nerve, C5 to T1, something like that, you know? And that just means that the nerves that are the median nerve is made up of the fibers that are exiting between the C5 and the T1 vertebrae, right? So between each two vertebrae arise a single a single spinal nerve, right? Just leave it at that. Now, the peripheral nervous system is made up of nerves, right? So these are just bundles of nerve cells. So a lot of nerve cells joined together are gonna make a single spinal nerve, right? As I said, the spinal nerve is the only component of the peripheral nervous system, really. Like it's just where the spinal nerves are. Now you can divide the spinal nerve into two forms, right? You can have sensory nerves or motor nerves. Sensory nerves are the ones that are going to be in charge of like temperature, sensation, pain, etc. Right? So like sensation, yeah. Motor nerves are going to be in charge of movement. Now, these spinal nerves can like once they come out of the spinal cord, they can go out and then, for example, branch into each other, right? So like they branch out and then they join into each other and then branch out again and then join into each other again, right? And they keep doing that. So they keep branching and joining and branching and joining. And this is called a nerve plexus, all right? This is called a nerve plexus. For now, there is one nerve plexus you need to know, which is called the brachial plexus. All right? The brachial plexus, brachium means of the arm. So it's literally a plexus, so a bundle of nerve fibers that keep branching and joining each other. That supplies innervation, so it gives nerve supply to the arm. That's all it means. So let me give you some sort of introduction to the circulatory system, right? So the circulatory system is composed of the heart, which is the pump, and the heart pumps blood into the arterial system via one main blood vessel called the aorta, one main artery called the aorta, all right? And the aorta keeps branching and branching and branching, and it goes and supplies blood to the whole body, right? So these will go to individual organs and supply their blood, okay? After that, the blood has to be drained back into the heart, and that is via veins. So like it's gonna keep branching and branching, eventually reaching into the capillary level, and then it's gonna have to go back to the heart via the veins, the vena cava, for example. Guys, please don't forget, arteries supply and veins drain. So don't come and tell me that there's venous supply to this area. No, there's venous drainage of this area. Usually there are no branches of veins. So instead of saying that there are arterial branches, you say there are venous tributaries. So it's the thoracoacromial tributary to the axillary vein. Now there's one more organ system that is not really given the credit it deserves, and this is the lymphatic system. It's incredibly important clinically. You're always going to have patients with enlarged lymph nodes, and so you should know what lymph is, you know? Alright, so basically, if you have some sort of tissue, alright, this tissue is constantly attacked by viruses, bacteria, chemicals, anything, right? And what you want in this case is for the immune system to come and defend you from it. Now, one way in which it knows about this is via the lymphatic system, or it's the main way actually. Basically, here you have a normal tissue, or some tissue, and it's filtered by these lymphatic vessels. So in literally every tissue, you're going to have these lymphatic vessels, all right, very small. They're about the size of a capillary. So you have these small lymphatic vessels that filter this tissue, all right? They literally just come in and they filter the tissue. So they filter it and it goes to a lymph node. And for now, just know that this lymph node is just a collection of a lot of white blood cells, all right? Doesn't matter what the structure of it is now, but just know that you just have a lot of these cells, which are white blood cells, all right? You'll find every type of immune cell here, really. Yeah, this is a very crap representation of a lymph node, but the point for now, the tissue gets filtered via these lymphatic vessels, and the lymphatic vessels enter into lymph nodes, in which it alerts this immune system, the immune cells, oh my god, there might be a pathogen here, there might be a bacterium, there might be some damage here that you might want to take a look at. Alright, so the subclavian artery literally means below the clavicle, alright? Because that's literally where you find it. So if you remove the clavicle and the cadaver, the first artery you're gonna see is the subclavian artery. Subclavian artery continues it's the same tube, right? And it continues into the armpit, the axilla, yeah, as the axillary artery. Axillary. Now, axilla literally means armpit. So the pulse you can feel in your armpit is this axillary artery. For the axillary artery, there's a lot of important branches for the upper limb, and there's a mnemonic for it. So the mnemonic is screw the lawyer, save a patient. Screw the lawyer, save a patient. This corresponds to the superior thoracic artery. This is the thoracoacromial artery. This is the lateral thoracic artery. This is the subscapular artery. This is the largest branch of the axillary artery. So you're going to approximately find a branch that is roughly the same diameter as the axillary artery. And that's going to be the subscapular artery. Now, These are the anterior and posterior circumflex humeral arteries. All right. Circumflex just means it goes around. So if you have the humerus here, all right, this is the head of the humerus. The arteries are gonna go something like this. All right, so they're gonna go around the head and neck of the humerus. All right, so that's circumflex. Circumflex. Now this axillary artery then continues in the arm. So after the armpit, the axilla, it continues in the brachium, which is the arm, as the brachial artery. All right. Now the brachial artery gives quite a few branches too, but the one I want you to remember for now is the deep brachial artery. All right. After that, the brachial artery then splits up into the ulnar and radial artery, and that's a very clear demarcation. All right, you might ask now, how do I know the difference between the subclavian, the axillary, and the brachial arteries since they're the same tube? It's just different names. I don't know why they named it this way, but all right. Anyway, now at the level of the first rib, so this is the first rib, right? At the level of the first rib, the subclavian artery becomes the axillary artery. Now, at the level of the surgical neck of the humerus, so the humerus is going to be somewhere here, right? And this is the surgical neck. So the humerus is here, and this is the surgical neck. At this level, it now became the brachial artery. All right? And the demarcation between brachial and ulnar and radial is pretty clear. Now, in the upper limb, you don't really have to know the names of the veins if you know the names of the arteries, because every artery has the same name vein very close to it. So for example, thoracoacromial artery is going to have thoracoacromial vein. Axillary artery is going to have the axillary vein. So you don't really have to know the names, except for two. These are the superficial veins that you see like on yourself, right? So like if you look at your arm, you might be able to see these veins. If it is lateral, so on the thumb side, all right? If it's lateral, it's called the cephalic vein. If it's medial, it's called the basilic vein, all right? And they join together at the elbow at the median cubital vein. So now, the brachial plexus. How do we draw it? So, for those of you Game of Thrones fans, there's a mnemonic that helped me. I don't know if it's going to help you, but here it is. Rob Stark drinks cold beer. So Rob Stark drinks cold beer. All right? And that's basically going to tell you the parts of the brachial plexus. And as I said, plexus is just a collection of nerves that keep splitting and rejoining and splitting and rejoining. And yeah, that's it. So what does this tell you? So it tells you that you have roots, you have trunks, you have divisions, you have cords, and branches. All right, I'm gonna explain what this means in a second, but just keep this in mind. Now, okay, so to draw the brachial plexus, start by drawing two Y's, all right? And then invert a Y and draw it the same way, all right? Draw a W here, an X, and a line. That's it. That's it. Now you just have to label, all right? So the roots are what I talked about. earlier. So remember how there is C1, C2, C3, right? So the brachial plexus starts at C5 and goes on to be C6, C7, C8, and T1. So it goes from C5 to T1. All right? So those are the roots. So the roots of the brachial plexus are these. Okay? And then you can see that these roots, right, they fuse, right? So they fuse to form trunks. So you have 1, 2, 3 trunks, all right? Now these 3 trunks are literally named by their anatomical position, and since they just exited from the spinal cord, so the spinal cord will be right here, all right? So they just exited from the spinal cord. They will be called as you can see them here. So it will be superior, inferior, and middle. Superior trunk, inferior trunk, middle trunk. Simple, alright? Now, after that, you've got your divisions. And your divisions just means that like these trunks, after they join, they divide again. So here you have division, here division, division, right? So these are your divisions, your X and your line. Now, after your divisions, you've got your chords, alright? So your chords are after they divide and they join again. So here, here, and here, you will have your 3 chords, right? They form chords of the brachial plexus. And they change their position a little bit. Instead of being called superior, middle, and inferior, they're called medial, posterior, and lateral. Alright? So, medial, posterior, lateral. So why are the chords called such weird names? Why aren't they just called superior, middle, and inferior and make our lives easier, right? But no, it's actually a good reason. The axillary artery passes at very close proximity to the brachial plexus, especially to the chords of the brachial plexus. So basically, the medial cord is medial to the axillary artery. The posterior cord is posterior to the axillary artery. The lateral cord is lateral to the axillary artery. All right? So if we go back here, we're going to have this being the medial cord, this being the lateral cord, and behind it here being the posterior cord. All right? Now, the brachial plexus terminates as these individual branches. All right? So you have 1, 2, 3, 4, 5. And these are the most important terminal branches of the brachial plexus. How I remember them is Mr. Mao. Mr. Mao. So, Mr. Mao. Alright? So, Mr. Mao. Yeah? And these are musculocutaneous nerve, radial nerve, median nerve, axillary nerve, and ulnar nerve. Alright? And notice that the median nerve is a combination of the medial and lateral chords. It's the only nerve that's like that. It's the only nerve that combines 2 chords. Alright? Okay, so I messed up a bit in the video and I switched up lateral and medial chords, but other than that it's a correct diagram, so I'm not gonna redo it. I also added a few extra, like less important nerves, but you still need to know them, so I'm gonna talk about them. And these nerves I labeled from 1 to 11. And so when I say number 1, I just mean the label that I have as number 1 in the picture. Alright, anyway. So, number 1 is the lateral pectoral nerve, and number 7 is the medial pectoral nerve. Alright, so they both basically do the same thing. They come out of the brachial plexus. So 1 and 7, which are the lateral and the medial pectoral nerves, innervate the pectoralis minor and the pectoralis major. So if you see a nerve going to either one, it's the medial and lateral pectoral nerves. All right. Number 2 is the upper subscapular, and it, along with number 4, which is the lower subscapular, so the upper and the lower subscapular, go and innervate the, surprise, surprise, subscapular muscles, so subscapularis, right? Now, the middle subscapular is also called the thoracodorsal nerve. The thoracodorsal nerve, or the middle subscapular, travels along the medial aspect of the scapula. So travels along the medial aspect of the scapula with the subscapular artery, and it goes to the latissimus dorsi. All right. The teres major is also innervated by both the thoracodorsal and the subscapular nerve. So and the lower subscapular nerve. So middle and lower subscapular nerves innervate the teres major. Middle subscapular nerve innervates the latissimus dorsi, and the upper and lower subscapular nerves innervate the subscapularis muscle. Alright, now, number 5 and 6 are the medial antebrachial cutaneous nerve and the medial brachial cutaneous nerve. The medial antebrachial cutaneous nerve, just let's break it down, alright? Brachial means arm, forearm means antebrachial, alright? Cutaneous means of the skin. So you've got the medial forearm nerve of the skin. So it's the medial sensory nerve for the skin. All right. In the forearm and in the arm. All right. So medial brachial cutaneous innervates the skin of the medial arm, and medial antebrachial cutaneous innervates the forearm skin in the medial side. Yeah, okay. Now, number 8 is the suprascapular nerve, and what you need to know about it is that it goes on the superior transverse scapular ligament, so it doesn't enter into the superior scapular notch, and it innervates the supraspinatus and the infraspinatus. Yeah, right. Now 9 is just nerve to subclavius. It's the most useless one. If you're gonna forget a nerve, forget this one. Now number 10 is the dorsal scapular nerve, which goes and innervates the rhomboids, so rhomboid major, rhomboid minor, and levator scapulae. Number 11 is the long thoracic nerve. Now the long thoracic nerve goes and innervates the serratus anterior muscle, which wraps around the anterior aspect of the rib cage, or the anterior lateral aspect, and it basically courses on the lateral aspect of the serratus anterior. That's it. Okay, now for the big guns, the Mr. Mao. I'm only going to mention them briefly because it's going to take way too long if I do them actually properly now. Hopefully we will get a chance to do it properly. Anyway, so M, musculocutaneous, and it comes out of the lateral cord of the brachial plexus and pierces the coracobrachialis muscle. Alright, pierces the coracobrachialis muscle and then goes between the biceps and the brachialis. Alright. After that, it gives some cutaneous innervation to the lateral forearm, but just for this, no, it pierces the coracobrachialis and it goes between the biceps and the brachialis. Alright. The radial nerve goes into a topographic region called the triangular interval, which I will explain in a moment. So, yep. So it goes into the triangular interval, and then it courses between the heads of the triceps, so the medial and lateral heads of the triceps, in the radial groove of the humerus, and then it goes to the forearm. Alright? The radial nerve, it's important to know that it innervates the entire posterior upper limb. The entire posterior upper limb muscles, so all of them. So the triceps and the posterior forearm muscles, they're all innervated by the radial nerve. Alright, just keep that in mind. If you have a posterior muscle, always go for radial. Alright. The median nerve, basically look for the M. So look for where the medial and lateral cords join. and you will see that as an M. On the artery especially, if you see an M, that's median nerve, right? Other than that, know that it innervates the anterior forearm, almost all of it. There are two small exceptions, but almost anything in the anterior forearm is gonna be median nerve, okay? Also, it innervates some of the hand along with the ulnar nerve. All right, the axillary nerve goes goes around the humerus, all right, via an opening called the quadrangular space, which I will also go through in a minute. All right, so it goes through the quadrangular space and it goes around the humerus, and it goes with the posterior circumflex humeral artery. So if you see some nerve going around the humerus with an artery, the artery is posterior circumflex humeral, and the nerve is the axillary nerve. Oh, also, the radial nerve goes with the profunda brachii artery. So the deep brachial artery courses with the radial nerve. When you see in the tricipital groove or in the triangular interval a nerve and an artery, the nerve is the radial nerve and the artery is the deep brachial artery, the profunda brachii artery. All right? The ulnar nerve is important for the hand muscles, but in the forearm it also innervates the ulnar half, because it's the ulnar nerve. So it innervates the ulnar half of the flexor digitorum profundus and also the flexor carpi ulnaris. All right? So, okay, let's recap everything, like all the main ones, very quickly. The musculocutaneous nerve innervates the anterior arm, so it innervates the carcobrachialis, biceps, and brachialis. The radial nerve innervates the entire posterior upper limb. The median nerve innervates most of the anterior forearm. All right. The axillary nerve innervates the deltoid muscle and the teres minor. Deltoid and teres minor, because they like the shoulder, they're shoulder muscles, and it goes around the humerus. All right. The ulnar nerve innervates hand, or a lot of the stuff in the hand, along with the median nerve, and also the ulnar half of the flexor digitorum profundus, along with the flexor carpi ulnaris. So now let's talk about the axilla. So here I'm trying to demonstrate the external aspect of the armpit, so what you can palpate. And basically anteriorly you've got the pectoralis major and minor. Posteriorly you have the superficial back muscle, or the biggest superficial back muscle, which is the latissimus dorsi. Medially we've got the rib cage and the serratus anterior, which overlies it. And superiorly, or deep into the armpit or the axilla, we've got the glenohumeral joint, or the shoulder. And of course laterally we've just got the arm, so we can just say humerus as the lateral border. The axilla doesn't have that many structures, like it does, but if you really simplify it, if you narrow it down, it doesn't. It has the brachial plexus and all of its branches. It has the axillary artery and all of its branches. It has the axillary vein and all of its tributaries. But one thing you must not forget, especially about the axilla, is the axillary lymph nodes. The axillary lymph nodes. Now, the reason this is important is because breast cancer drains primarily to the axillary lymph nodes. So, if someone has some mass in the breast, along with a mass in the armpit, it is suspicious. It is suspicious for some sort of breast problem. So posteriorly, something that's not palpable is the scapula and the associated structures with the scapula. So the subscapularis, the infraspinatus, the supraspinatus, the teres major, the teres minor, even the long head of the triceps from the infraglenoid tubercle. But if you think about it, if the structures associated with the scapula are there, it means that the teres major, the teres minor, and the long head of the triceps are there. And those give rise to some interesting topographic regions. Now you can do this hand gesture that I'm showing to visualize these structures, and that opens three topographic spaces. So you have the triangular interval for the passage of the radial nerve and the deep brachial artery. You have the quadrangular space for the passage of the axillary nerve and the posterior circumflex humeral arteries. And you also have the triangular space for the passage of the circumflex scapular artery. Now, this circumflex scapular artery is a branch of the subscapular artery, which is a branch of the axillary artery. So basically, the axillary artery gives the subscapular artery, and the subscapular artery divides into two: the thoracodorsal artery and the circumflex scapular artery. And circumflex, just like the humerus, it just means that it's an artery that goes around the scapula. And that's basically what you need to know about every topographic region. So you're gonna meet a lot of topographic regions, and what you need to know is the borders, the contents, and the communications. So what other topographic regions are associated with this topographic region. All right, so let's recap that for the axilla. So in the axilla, the anterior border is the pectoralis major and minor. The posterior border is the scapula and related structures, along with the latissimus dorsi. The superior border is the glenohumeral joint, and the medial border is the rib cage. All right, so those are the borders. Now, the contents are the axillary artery and its branches, the axillary vein and its tributaries, the brachial plexus and its branches, and the axillary lymph nodes. Please do not forget the lymph nodes. And since the posterior border is the scapula and the associated structures, the axilla will communicate with the quadrangular space for the axillary nerve and the posterior circumflex humeral artery, the triangular interval for the passage of the radial nerve and the deep brachial artery, and the triangular space for the passage of the circumflex scapular artery. Now, one more communication worth mentioning is the deltopectoral triangle, or the clavipectoral triangle, and that's basically a triangle between the deltoid muscle, the pectoralis major, and the clavicle. All right, and it's important because it's where the cephalic vein, which we've spoken about, it's the lateral superficial vein, right? It's where it goes in and drains. It's where the cephalic vein drains, and you could also find the pectoral nerves there. So like the lateral medial pectoral nerves, you can also find them in the clavipectoral or deltopectoral triangle. And communications here just means that the structure has the choice of leaving the axilla directly. So like the median nerve, the ulnar nerve, they lead directly into the arm, right? Or they can choose to go through one of those other openings or communications, the triangular space, interval, or quadrangular space. So when you're asked to draw the axilla, a scheme of the axilla, how I do it is I draw a sagittal section, because really all you have to show then is the anterior border, the posterior border, and the contents. So yeah, so I'd start off by drawing some bony landmarks, such as the clavicle and the scapula. And the clavicle has the subclavius attached to it, which literally means below the clavicle. So it's literally just a tiny muscle below the clavicle, which really does nothing. Other than that, the pectoralis major attaches to the clavicle, and so you will show that going down, along with the pectoralis minor behind it, so like deep to it. Now, The pectoralis minor is ensheathed in the pectoral fascia, and you would then go and draw the posterior border, which would include the latissimus dorsi and the scapula and associated structures, which you should know quite nicely, like the subscapularis, the supraspinatus, the infraspinatus, the teres minor, and the teres major. Superficially, you can also draw the trapezius, but yeah, that's pretty much it. And the contents, I would personally draw the axillary artery with the cords of the brachial plexus surrounding it. Remember that the medial, lateral, and posterior cords are named so because they surround the axillary artery in that order, along with the axillary vein. But also remember to mention the lymph nodes. You don't necessarily have to draw it, but remember to mention them. Like write a note in the bottom or something that axillary lymph nodes exist.